Just letting everyone in. Looks like we have one more that's joining, and then we'll start. Mhm. Okay, perfect. I am Brooke Nowicki. I am the career coordinator for the College of Communication Information at UK. For those of you that don't know me, I am so excited for our last webinar of the semester. It is Where Information Meets Medicine. Today we have Lauren, Cayla, and Tiffany who will be joining us later, and I will let them take it away.
Wonderful. Okay, thank you so much, Brooke. And thank you for everyone for attending today. As Brooke has said, my name is Cayla Robinson. Tiffany will join us later and I'll let Lauren introduce herself. But as Brooke said, this is where information meets medicine, navigating careers in health sciences libraries. So just a little bit of introduction before we get to the actual introductions. Today we're going to talk about types of health sciences libraries, professional organizations, resources for HSLs, health sciences libraries. You have to get used to the acronyms in librarianship, so there's one of them. MCL Resources and MCL events. And actually, as I'm looking at this, I realized I reordered the content of the slides, but not this. So that's excellent. Excellent stuff. If you get a jump scare of like a professional org after a resource, don't be alarmed.
I would also throw out MCL as Medical Center Library.
Oh, yes. MCL, Medical Central Library. That's where Lauren, Tiffany, and I work. Another acronym. There's like 7 on this page, it feels like. So, okay. So first things first, as I said, my name is Cayla Robinson. I am a health sciences librarian at the MCL, the Medical Center Library. I am the liaison to the College of Health Sciences, and I specialize, my research interests are in research methods and student mentorship. And I'm actually teaching LIS 627 in the fall. So if you're interested in this, come learn a little bit more about consumer health information from me and some of my friends. And now I'll let Lauren introduce herself and Tiffany.
Yeah. So just to confirm, are we giving some of our background here too, Cayla, like where we
Sure.
came from? Like, is that
Yeah,
what? I just wanted to confirm that's what we're doing.
absolutely. You
So
have
my
a
name,
little bit more than I do.
yeah. But you have an interesting background story too, of how you came into medical librarianship. So you should definitely share that as well. Um, so my name's Lauren Robinson. I am the Associate Director of Research Services and the liaison to the College of Medicine here at the Medical Center Library. My interest evolve around systematic reviews and other type of evidence syntheses. I work a lot with mobile accessibility as well, and research data management, citation analysis, and other general research services. That's kind of my area of interest. My background, so I do have a health science background. I always like to tell people who are interested in like considering health science librarianship, you don't need a health science background. You don't, like most of my colleagues don't have that. So I just like to throw that out there, even though I do have a health science background, most of us do not. So I have a health science background, like I was saying. I ended up switching into library school after working in a public library, where I worked in like a technology area. And then I graduated from the University of Kentucky in the library school in 2015. And then I kind of have a weird pathway. I did some instructional design, and then I ended up doing emerging technologies at the University of Louisville for a while. And then I came here to University of Kentucky, I get in 2019. So I guess 6 years, is that right? I've also participated in clinical librarianship, which we'll talk more about here in a moment, I believe. I've also worked a lot with academic curriculums. So I sit in on curricular meetings, and I help, and I actually teach in the College of Medicine in one of their courses for first year med students. So it's like and I also have all these areas of research that I like. So it's a really diverse job, I will say. And I would say all of us have a windy path into medical librarianship. Um, and then Tiffany, I work with Tiffany off and on for almost 10 years now. Tiffany is our director. She started here last year at the University of Kentucky. She actually started as a student in medical libraries, not like even a library student, just a student worker. And so she had a meandering path, and she'll talk a lot about like her mentorship if you ever meet with her. And like the mentors that she got in health science libraries, what got her to go to library school. She actually had an internship at the University of Louisville while she was going to library school. Her areas of research has been in collections and mentoring and student supervision. And yeah, so if you have opportunity, I think she's going to try and pop in. But if you ever have questions about her background, she definitely loves to talk to people about it.
Sure. Okay. Thank you, Lauren. Appreciate it. You'll hear more from Lauren a little bit later. And then me, so I am the newest of the three of us, the newest librarian. So I received my bachelor's of English literature, remember that, in 2018. And then the end of 2019, I started the LIS program here at UK. I was the graduate assistant for the Medical Center Library for both years. And then I graduated in May 2021. And then immediately upon graduation, August 2021, I started here full time as a faculty librarian. My pre-experiences, I was a children's librarian at a public library, which is funny because if you know me at all, I'm not very good with kids, but I'm pretty good at reading picture books, they found out. So they had me do the story times, which was actually fantastic. Fantastic for me as a person. Maybe the kids didn't have as much fun, but I did. So it was great. I worked then as a volunteer research assistant for one of my mentors from the University of Cincinnati. And that's how I kind of found health sciences librarianship. I didn't really know what it was until then. Now I'm going to do it forever, which is really exciting. And I'm, as I said, the newest. So any questions about like making it through school or like finding jobs, those are things that are still pretty fresh for me. So if you have any questions about that in the future, you can always let me know. Okay, so that's us as humans. Let's talk about what we do and what health sciences libraries and librarians are kind of like as a whole. So there are a few types of health sciences libraries. Some of them aren't even called health sciences libraries. The main one is working at an academic medical center. And so the university medical libraries, there's two routes. Most faculty, even most staff librarians work as an academic medical center librarian, which means that you are primarily working with different liaison groups, so different health sciences colleges. Like we said, I'm health sciences, Lauren is medicine. It's kind of like a team approach where we share different colleges and things like that. And we work a lot on research and instruction, teaching students and sometimes even faculty and staff how to find resources, how to utilize our resources to the best of their abilities. It is a lot of research, heavy research based, so finding literature, synthesizing literature, things of that nature. The clinical model is actually something that Lauren and Tiffany both have experience doing, but the clinical model is heavily focused on being with the clinicians while they're doing active work, which means that sometimes librarians will go on rounds with their clinicians and like be right there to pull up information as needed. They'll do like sit down meetings with clinicians where they'll talk about patient cases, and the librarian can be there to kind of pull up information on a pathology or a disease. It is very hands-on work. I've never done it. Lauren has. So if you have questions about that, please let us know and we can tell you, well, she can tell you more about it. But those are where they differ. So the clinical model will also work with instruction and engaging with people on how to find appropriate resources. There's just that emphasis on rounding and sitting through patient cases. There's also hospital libraries, which they're kind of few and far between now. There are a few really awesome hospital librarians working in the state of Kentucky, if this is something that interests you. The goal is to provide healthcare practitioners with information. Usually they're solo librarians as well, so there's like one person surrounded by periodicals, sometimes books, not that often, and they kind of help those clinicians pull up resources on anything that they're curious about or anything pertaining to patients. And then finally, our actual consumer health libraries. Once again, there's not as many of these. There actually is one at UK. I don't know if you all know Abby Thorne, but she is the consumer health librarian over at the Consumer Health Information Center. The goal there is to provide easy to consume, easy to read health information to nurses, staff, doctors, and most especially patients. This is to kind of explain a disorder, a disease, some type of health concept to a literal patient. A lot of that is like infographics and things that are easy to read, easy to understand, because we want everyone to be able to come in and access information regarding their health. And that's what this is. Sometimes these people work with other clinicians like nurses who specialize in health literacy, clinicians, but usually it's like kind of just a solo librarian once again. And those are the types of health libraries. There's probably more that are a little bit more niche than this, but these usually are the main buckets that they fall into.
And I'll just put a little plug in. If you're ever interested in talking to librarians in these areas that maybe aren't here at UK, we do have contacts throughout the state. So if you're interested in learning about hospital libraries, like we can connect you with people in those areas.
Mm-hmm. It's wonderful. It's wonderful work that they do. And it's really interesting, truly. Okay, so here's the jump scare of the professional organizations before literally anything else. The point of this is to kind of give you all a primer to health sciences librarianship, and we can only give you so much information in these sessions. The world of working in healthcare adjacent is vast, and it's really easy to be scared, but I promise it's not scary, and there are so many resources that are available to you to kind of teach you some of the skills. The Medical Library Association is the big bucket organization. So it's kind of like ALA for people like me and Lauren. This is our big organization. It is kind of expensive for students. I will say it's $64 a year, and you can only be paying the student fee 2 years in a row. It does provide you with access to networking, things like caucuses, but some of the more important resources like the MLA job board are free to access regardless. This is by no means like a necessary thing that you have to have if you're interested in health librarianship. It just can provide you a little bit of extra resources if that's something that you're interested in. And it does allow you to pay the member student price for conferences. So if you are interested in conferences, I don't know if I would recommend starting with MLA as a student, but that is absolutely something you can do and will do later in your career. So, MLA, you can always peruse the website too. Some of the things are paywall restricted, but not all of them.
I would add that a caucus is kind of like a special interest group too. So like MLA has a lot of them. We even like have a veterinarian group. So these are
Yes.
veterinarian librarians who also work in like medical areas who all have a caucus where they share information and things like that. And then we have ones for systematic reviews. Cayla is the chair of the public health or incoming chair for the public health one. So like if you are interested in learning specific areas, if you are a member, those are free to join to get on their listservs and things like that.
Absolutely. And if you want to see what it looks like behind the paywall, we can absolutely show you what that website looks like after the presentation. So the best thing you can do as a student is join these regional medical library associations. So I kind of said MLA was like the bucket. These are the ones that kind of fall underneath. So everything else is affiliated with MLA in some way, but it's not MLA, which means it's cheaper. So the regional medical library associations that most of us at the medical library are a part of is either MLA Midwest or the Southern chapter. MLA Midwest is fantastic because it is free. Well, it's free to be a member of both. You can literally just join either, and then you'll have networking opportunities and job board postings and all of those lovely things that come with joining an organization. But it's free for you as students. You can join both. No one will stop you if that's what you want. I'm in both. Don't tell anyone. But the conferences aren't free. The MLA Midwest Conference is the best one, in my opinion, for students because it's virtual and it's only $50 to register. So if that's something you're interested in, you want a more larger conference to present your work at, this one's relatively cheap. but joining is completely free. And then they also have like meetings and special interest groups, like Lauren said, that kind of can help with your professional development if that's something you're interested in. MLA Midwest Southern Chapter are fantastic organizations, and they're people that are usually fairly local. Kentucky is kind of weird. We like fall into a bucket of half of us feel Midwest, half of us feel Southern. So that's why most of us are in both, because we know people from all across these areas of the country. And then finally, my last bit here before I give it over to Lauren is the network of the National Library of Medicine. It's NNLM, another acronym, MLA, NNLM, SCMLA. You don't need to know these. You just need to know what they are. The NNLM is affiliated with the National Library of Medicine, which is the NLM, and that is owned and operated by the NIH, the National Institute of Health. So it's nested very deeply into the government structure. But NNLM is not an organization, it's not a conference group, it's none of that. It is simply just a place that you can create an account for and go and look at free webinars, join free networking groups, get a lot of really good information. The other two, MLA has a lot of paid webinars. The NNLMs are usually completely free, and you can get this thing called another acronym, a CE credit, which is a continuing education credit, which can go on your curriculum vitae, your CVs. There's too many acronyms. I'm losing my marbles. This is wonderful, though. If you do nothing else, if you take nothing else away from this, the NNLM has so many really awesome resources, especially for like students and early career librarians such as myself. I highly, highly, highly recommend making an account. That's it for professional organizations. I'm going to leave the rest of this up to Lauren. But once again, if you have any questions, please just let us know. We'll be happy to answer them and show you some things after we're done.
And I would throw out, like, if you are interested in presenting at a conference, doing a poster, just kind of getting your feet wet, if you're interested in academic librarianship, especially, the MLA Midwest and the Southern chapter of MLA are really great places to do that. They often accept students. That's where actually where I started first presenting, and it's just like it's a really easy way to do it, and you get a lot of good feedback. So just as a, some food for thought there. And then NNLM also will, since it is funded by the government, there are opportunities, like Cayla said, to do those free trainings, but some of them can lead to certifications, and they can actually help pay for your certification if you complete all the courses. So if you're ever interested in any of that, like again, like Cayla said, you can reach out to us. But I agree, those are really great places. But I always like to mention the regional groups as an opportunity to do like a poster or something. And even if it's about a school project that you're working on in class, or if it's just something that you're interested in and you've done research on, like they're very informal type of spaces to do that. Okay, so we do have a lot of mentorship opportunities. Cayla and I have done a lot of this, and Tiffany again has some interest in this as well. So we're all here to help with this. We want to talk about some opportunities we provide here at the Medical Center Library. So we do offer internships. These are paid work experiences. We don't have one right now, but if you are going to be in school in the future, in the next couple years, that's something to consider. We do send that out on the listserv when we do have opportunities available. And then we also have practicum. So these are unpaid work experiences. But they do give you course credit. So we've done several of these. I've hosted a couple students over the years who have done practicums. Cayla has hosted a couple students. We're actually hosting one, I believe, next semester as well. Our outreach and engagement group team, I believe, is hosting a practicum student. And these projects are really kind of based off like what we have going on and then also what you want to get from the experience. So they're usually project based. We've had people help us with our health disparities guide that we launched. launched. Oh, okay. Hi, Sarah. Yep, there we go. And so like there's lots of opportunities, and we do take it into consideration what you want to learn out of it, right? And we also have a curriculum that we provide around these practicums and internships where we go more in depth about the things we're covering today. And even if you aren't interested in doing that and you want to know some of that information, you're more welcome to come to those too. But we do things about like searching, like advanced searching. We go over different databases. We go over scholarly communications and systematic review intros and stuff like that. So you at least are familiar with these things when you go to apply for jobs and after you graduate. And then we also do informal mentorship. So these are available to anyone. Like if you're just interested in health librarianship, you want to talk to us, we're happy to do that. And as Cayla put here, our graduate student training series. So that's Cayla's leading that this year. It's something I led a few years ago. And so we're always adding it, and we add things based off what you're interested in too. So the actually the slide previously that Cayla was doing, that actually we did a session because students were asking like, what are all these places? Where are good places to start to get some professional development? So we actually had a whole session on that. So that's one reason we included it here too. So these are some of our mentorship opportunities. We're always happy to do anything that you need. And please reach out. Okay.
I will say about the practicums really fast. So some places will like put out a call. Like we have this project. We want this number of students or a student. It's unpaid or it's paid. There are paid practicums, not here quite yet, maybe in the future. So we only, oh, I'm on the wrong slide. Goodness gracious. We only accept practicum students if they're solicited by you all as the student. So we have people who come to us and then we usually like are constantly working on things. So we'll slip a practicum student into like an active or a future active project. So if you are interested in that, there won't be like MCL is looking for practicum students. It will be more like, hi, I want a practicum. Are you all have any projects available in the summer or the spring or the fall? And then we talk amongst ourselves and see who's working on what. And we'll usually accept at least one student a semester, depending on if there is a project. So please always just ask if that's something that you're interested in. We can't guarantee
Yes,
there
and
will
reach
always
out
be
early
projects.
too. Like if you know, like in 2 semesters you want to do that, reach out early would be a recommendation, just so we have time to plan and you have time to plan. Just makes things easier.
Makes things so much easier. And then you get to work with us, which is so wonderful. Okay, back to it. Oh, what? What happened here? Oh, okay,
That's
goodness gracious.
right. I think
No,
that's
that's
right.
right. I thought that was the
Everyone's going so
that
well.
was the slide
Um,
thing.
so these are just some resources that are available to you that we wanted to go over. Of course, the Medical Center Library homepage, you can tool around now and there whenever you want. The other ones are more like specific. So our evidence-based medicine guide is just something if you're interested in health librarianship to be familiar with evidence-based medicine. If you're applying, excuse me, if you're applying for jobs, you will be asked about evidence-based medicine or evidence-based practice. It's called both of those things. Evidence-based practice is a more general term. So we just linked that guide here. There's a lot of tutorials on there and information. It's really geared, I will say, more toward like residents who have already graduated medical school and are in their doctor training. Um, and so like, but again, it's just a good thing to know about. There's some articles linked there about like the basics of evidence-based practice. And so that's just one resource. Then the research and publishing guide is something that covers like scholarly communication type of topics. So it has stuff about open science framework. It has stuff about data management. It has stuff about impact and measuring your impact. And these are very good introductory topics just to become familiar with. These are things that we answer questions on every day. And I would say like scholarly communications and research services like systematic reviews and literature searching and things like that are the largest parts of our job. That's what takes up most of our time. And I would throw out that like if you're not familiar with literature searching, almost all medical libraries do this. And so we will get requests from clinicians, and they will ask for like articles on this IV therapy or whatever it is, and we will return results for them. So like that's a common practice for us. They're not usually emergent issues. We do occasionally have ones where it's an emergent lit search where they need some information about, and we do prioritize those. But anyway, that's a little side note about literature searching. I just kind of want to explain what that is and what that entails. Um, and then there's also our workshop series. So we do a research workshop series every semester, and these are freely available to you to attend. I'm actually doing one tomorrow on animal research and iCook searching. And iCook is an institutional review board that looks at all animal research happening on a specific campus. So I'll be talking about how to build searches for that type of research. But there's tons of other ones. There's Introduction to PubMed and CINAHL, which is a nursing database. There's things about data management. We did a really cool one last fall called the Horrors of Research series, where we talk about some of the problems in research. And that one's just really neat if you're interested in learning about some of the problems that we deal with and we teach about all the time. Both some of my colleagues, our data librarian, Isaac Wink, and then my colleague Rebecca Morgan worked with me on that thing. So those are just some interesting ones. We'll be offering ones next fall as well. We have this one and we have a free drug resource one coming up, I think, next week. And those are always up. And we're updating that page now. So you might see it change. We're making it a little bit more friendly and easier to find videos. But all the videos are there and the slides are there. And then Learn to Search in Health Sciences. I believe that links to our database searching skills page. So we are working on updating that too, but a lot of it's still kind of similar. We go over PubMed a lot. We go over subject headings. We go over just general Boolean operators and things like that inside of medical databases. And that's a tool we actually link on all of our guides to all of our users groups as well. So those are just some of the resources we want to highlight. All that stuff's freely available. And here's this upcoming event. So I'm doing an effective and responsible database searching for animal research tomorrow. And then we have free and clear introduction to reliable open access drugs on the 30th. And then please come. We are hosting a National Library of Medicine exhibit. There's a reception and are we having a lecture? I think the lecture got canceled, right?
Oh, that would be news to me.
Oh, I don't know. We are having a reception
Come
and
anyway.
yes, come anyway. And the dean, oh no, there might be a lecture with Dr. Ambrose collection. So we have a donors
Yeah.
collection that's going to be presented as well about like the history of like plants in medicinal uses. And our dean will be giving a small introduction, I believe, to the exhibit as well. I think there's going to be snacks. So if you want to see the space, we welcome you to come out and see it. And then also just spend some time looking at the exhibit. And we have another one coming next year. So this will be an ongoing thing. So please come. That's on May 5th from 11:30 to 1:30. And you can always reach out to us if you want to get like a tour of the library that day. You're down there. And we can send you a map too. If you have, we are kind of hard to find. So we do have a map that we have given people that we can dig out and send to you. We have a big sign now, so that helps things. We got a big sign on a white wall, so it's a little easier to see. But yes. And then we'll just open the floor up to questions. We're happy to answer anything about like our careers, about how we got here, about any of the services and things like that about health librarianship.
If we said anything, then you don't understand what we were saying, but you want to, we absolutely can talk about that too. Whatever you guys want. Okay. And you can also email our McLib. This is where we ask that if you would like to solicit a practicum for not this summer, but in the future, that is where we ask that you direct that. You can email us individually as well, but it would just be, you would get everyone if you send it there. And that is the best way to contact all of us at this point. Thank you, Rhonda. Thank you so much for coming. We really appreciate it. If you have any questions, please, we'll be here. We can even, maybe, is the recording off?
I can turn it off for the questions. Okay, I'll stop it.